We are back. Yay. Thank you so much, everyone, for your patience. If you stood by while we got through a little technical difficulties, but we're going to dive right back into all the good stuff that we have to talk about today. And I'm so happy to have my guest, Zan, here today to talk about the Autonomous Excellence Blueprint that she has created for healthcare organizations in order to bring them the best patient outcomes at the end of the day. So, Zan, let's start with hearing all about your blueprint. I know we had some practice behind the scenes, so let's talk about it. I want to know everything about it.
Sure. So, with my autonomous excellence blueprint, it initially started as me really, after I transitioned out of my previous role, um, I believe it was about 8 months ago. Um, I really wanted to package up all of my expertise and really take it per se, take it on the road. And it started out as a framework that I build upon, but as I did more research and taking into account that I have my doctorate in nursing, that is so important to have the foundation of evidence-based practice. So I did my research, found three committed, not found, but committed to three really great principles that really are the foundation of my autonomous excellence blueprint. One being Ray Dalio's principle. I first heard the term as I was going through LinkedIn. I do a lot of research on LinkedIn in addition to the regular research that we all do, constantly staying abreast of evidence-based practice. But this term really rang heavy with me. Now, this is the first of three principles that make up my foundation. In this principle, it's all about making sure that people feel comfortable being truthful about whatever happens. If you have a situation and there's an incident that occurs, you want to have an environment, a culture where it's okay to feel comfortable to admit, okay, yes, I did this. And the goal as we transitioned into the next principle that I use is to be able to kind of look and really delve into. I use the 5 whys, one component of many of the Lean Six Sigma approaches that I use, but using the 5 whys to really drill down. And in order to be able to drill down, the team members that you're drilling down with, and when I say drill down, I'm really talking about drilling down to the why. Those individuals have to feel comfortable. They're not going to be punished. That drift in practice happens. So it's important that we embrace that, we address it, and put measures in place so it doesn't happen again. So those are the two. The third one is something that is a little touchy subject I have learned as I've moved through my leadership progression, is the discussion on the just culture approach. I believe wholeheartedly in it. I believe it has to be embedded in every single process or workflow that the team comes up with and agrees to. And it's got to be, I've found that there's been concern with just culture because people really don't understand what it is, like why you use it. And it's one thing for executives and mid-level leaders to know, but you have to have the team members who are doing the work, who are at the bedside. They have to be educated and really know that it's not a punishment. It's an algorithm that really shows if this is a human error or a system error. So I have all of that embedded, and my experience, my approach is proven through my success over the years.
That's pretty neat. So, can you tell me a little bit about the what did you call it? The just?
It's a just
I'm not familiar with it. Maybe others that are listening, and I'm sure most of the DNPs listening would know. But can you tell me what that is?
Absolutely. The just culture algorithm is really something that's put into place. And once again, all of this meshes together with Ray Dalio, even though, the research that I've done, I haven't really seen it all put together, but it truly allows for an environment where you're partnering with human resources. Your team members understand that the system, the healthcare system or the clinic, wherever you work, understands that errors are going to happen. Our goal is to eliminate errors or lessen them to the point of elimination. So
Sure.
in those types of environments, when you're sitting down with the team, you're doing these work sessions, it's key, it's important to understand and to have the team members understand. When I walk you through a process, for instance, you're seeing an increase in CLABSIs or bloodstream infections. When you walk through those processes of what a nurse does, that could, and it's not just the nurses, there are so many people that touch the patient that could be impacting as well. So that's another component that I really believe heavily in looking into. But when you walk someone through their workflow, you want them to know that it's okay. We're here to identify the problems. We're here to understand what drifts in practice have occurred and how we can, as a system, because often it's a system failure, not necessarily an individual person failing. Those are easy to decipher, but that algorithm gives you steps to make those decisions on how to approach a failure in practice. And I hate to use the word failure in practice, but I'm just being realistic.
Sure. I think we need to be realistic. And what are some of these pain points that would cause a leader to reach out to you for this sort of help?
Absolutely. Well, the key thing is within organizations, they have their mission and vision. They have these KPIs that have to be monitored and have to be measured on a regular basis, and these benchmarks that are monitored. So if an organization realizes, okay, our patient experience scores, we've been, and that's a large percentage of reimbursement for organizations is patient experience. So if they realize that, okay, we need a little bit of help, and I never want to take away from what already exists in the organizations. You may have a patient experience manager or an operational excellence team who is they're like gurus at this process improvement, but you have a nurse here who is an expert at process improvement, and then you've got an expert who has the relationship with the team. So what better way to bridge that? Never like wanting to step on any toes, but just really being truthful and honest. Like, there are doctorate prepared nurses out here who have a skill set that is being so underutilized and so recognized. We could totally be the bridge to solving so many problems. I'm not sure if many people know this, but it is a proven fact that nursing practice is years and years and years behind research. You've got these PhD, these wonderful terminally prepared PhDs who do this research, and you've got these educators who know what best practice is, but guess where it's getting lost? In the healthcare system, where, and it's not always, I'm not taking away from anybody or any organization, but that is an opportunity that people could look at. If you see that, okay, we've been working on patient experience for, oh, wow, this long, and we might get to a certain point, but we're dropping back. That's because sustainability isn't in place. I have sustainable measures that I use to ensure that you're continuing that success that you've made it to. So it's just fascinating to me that the DNP role is not as utilized as it should be.
Well, that's why I think these types of conversations are so important, right? Because they are going to be healthcare leaders that perhaps don't know that you have this blueprint that they can use. And yes, they've taken all the steps to improve all of those things that you just mentioned, but they keep going right back to the ground floor, and they need the help. I think that you sharing this story and other DNPs that are now consulting, I'm just amazed at how many are doing great work. And I think it's important to get everyone's story out there and what I'd call your signature product out there, because we need it. The organizations need you. So thank you so much for sharing. I want to hear more. I know that you've worked in specific specialties and with some clients. Can you share a little bit about, who you are targeting right now, and
Sure.
just share, maybe you have a story that you can share
Absolutely.
where you've implemented the blueprint.
Absolutely. So, just to kind of backtrack a little bit, my core services that I provide at Innovative Healthcare Strategies is organizational consulting. And we've kind of delved into that a little bit. And then nurse career coaching. But to add like the last component here, I truly have a passion for AI. So I have strategic partnerships with AI companies as like that expert. It's so interesting that these folks outside of healthcare have an appreciation and a fascination for doctoral prepared nurses, and we're running with it. But the types of clients I'm really focused on, and if just to kind of hone in on this, is those chief nursing officers, those CEOs who really want to partner. I have such expertise at utilizing the autonomous excellence blueprint in, just as examples. During COVID, you and I were talking earlier, like during COVID, my responsibility, I was in charge of the ICU, the progressive care unit, telemetry, dialysis, codes, rapid responses, you name it. I had that service line. So during COVID, it was imperative that I start additional ICUs. Within 1 to 2 days, I had put up 2 additional ICUs, highly functioning ICUs. It took 1 day for one to get up and going, and then we found another location, and it took a day to get that one going. Myself and my team utilizing Lean Six Sigma, utilizing the fact that we have to make this happen. We have to still keep life going in that realm, in the hospital setting, but to be able to utilize structures and standards to move forward. That was one experience. I have started a diabetic education program with one of our outpatient clinics, working with the doctors, doing community service, bringing that all takes structure. That all takes a standardized approach, and not to be person dependent. My goal is to help and put things in place for this to occur.
Sure. So you empower the organization that you come in to help. And oftentimes, like you said, they may have someone in-house that does something similar, but you're there to help bring in a different perspective. And that's what's so great about an outside consultant, right? We can go in there and see things that those that are internally are blind to, because they see it every day. So
every day.
You miss what you see every day.
Exactly.
So we get to go in there, we get to take a look, and from the outside perspective, give some great advice. And so I would like to know, how does somebody get a hold of you, and how does somebody hire you to help their organization?
Yes. Well, there's a couple of ways to get in touch with me. If you really want to get in touch with me, like yesterday, I'm on LinkedIn all day. It's just a passion of mine. I'm really building my network and just really focused on identifying who those people are that I can help. But if you go to my profile, select book an appointment, and there's different options there. But I'm really, really, really looking forward to meeting with any vice presidents of healthcare organizations, CNOs, CEOs. I've been there, done that. I can walk the walk, talk the talk. My work speaks for itself, and I would just love to have that opportunity. And then I also have an email that we can put out for everyone. It's kind of lengthy, but yeah.
Absolutely. We will drop it right in the comments as soon as we are done here. And don't forget, you're going to be at the workshop next week, right?
Yes,
Yeah.
I thank you for that. I'm really looking forward to it. Really looking forward to
I'm hosting a 3-day workshop. And it's going to help you become visible on LinkedIn. So I've been doing LinkedIn now. I said doing LinkedIn because it's been kind of like a project
Yes.
for quite a while. But yeah, most of my success in sales has been here on LinkedIn. And with so many nurses becoming consultants and healthcare professionals now starting their own businesses, it's so important for you to become visible on the world's largest business network, right?
Yeah.
This is where your clients hang out. And so it's important for you to do the work. And I'm going to show you how to do it and make it super easy, super fun. It's 3 days. We're going to all hang out. And the great thing about it is there'll be other consultants on the calls. And so you'll get to network that way. And so I'm really excited. So if you can make it next week, the link is also in my profile. It is Profile to Profit, leveraging LinkedIn. So thank you guys so much. Thank you so much, Zan, for hanging out with me.
Can I mention one more thing? One more thing. As a freebie, if you reach out to me, healthcare organizations, I am looking at workflows that I can put together as a sample for you, a freebie, and enhance that into an AI bot just to show off my work. I really, really want people to see what I can do. So thank you, Claudia.
That's kind of a big freebie.
It is. It is.
Wow. All right. Y'all heard it from Zan's mouth. You get a really cool freebie. That is amazing. A workflow created through AI, and she's going to help you do it. So, yay, exciting stuff. Well, thank you so much for your time. Sorry again for the technical difficulties in the beginning, but that's okay because we still show up. Nothing's stopping us, right?
Thank you all.
All right. Thank you. Have a wonderful week. Bye, everyone.
Bye-bye.